Today's Health Watch. Parents may have heard differing vaccine recommendations depending on the source. The U.S. Department of Health and Human Services, under Secretary Robert F. Kennedy Jr., recently changed CDC guidance, while the American Academy of Pediatrics kept its own recommendations. That means some advice for healthy kids and pregnant women is now conflicting. So joining us now is Dr. Lindsay Fish from Denver Health to explain what's changed, what hasn't, and how parents can make the best decision for their families. This is very confusing. So what have we done in the past when it comes to flu season and recommendations on vaccines?
So we know that vaccines are the best way to prevent severe illness like hospitalization and death from all of the respiratory illnesses we have: influenza, COVID-19, and RSV, which is respiratory syncytial virus. In the past, we've always had recommendations that match and are in alignment. And that has been a flu vaccine every year for anybody over 6 months, a COVID vaccine for most adults and children over 6 months and all pregnant women. And then RSV, we really need to protect newborns. So that's either a vaccine for mom during third trimester of pregnancy or a shot for the baby right after they're born. That's what we've had in the past.
All right, so under the new CDC directive, under the HHS secretary, what is the new guidelines?
So the change really is with COVID-19 specifically, and that guidance is that they no longer recommend the vaccine for all healthy children and for all pregnant women. They instead recommend that you talk with your doctor about this and make a decision. They do still recommend vaccinations for influenza over the age of 6 months and all of the protection for newborns for RSV.
All right, and what are the Academy of Pediatrics recommending?
Yes, the American Academy of Pediatrics is our largest organization in the U.S. of pediatricians, over 67,000 pediatricians. They base their guidelines on recommendations and review of all of the literature, the evidence, the research out there, and our nation's leading experts in these fields. They recommend that we continue to vaccinate for COVID-19 children ages 6 months to 2 years, and for children who are ages 2 to 18, only if you have high-risk conditions. They continue to recommend flu and RSV.
Obviously, this is very confusing, and as a parent, what do I do here? So what should parents and caregivers do?
So I think the first thing to remind everybody is that vaccines are very safe. We've been doing all of these vaccines for millions of people for many years. And so it is really important. So absolutely get your flu vaccine, everybody over 6 months. Protect your newborn from RSV. Now, of course, it's tough on COVID-19, tricky to make a decision when guidance is different. In general, most physicians support the American Academy of Pediatrics and their recommendations. Of course, if you have concerns, talk with your doctor so you make a well-informed decision. And most physicians also support the American College of Gynecology and Obstetricians, who recommend vaccination for COVID-19 for all pregnant women. Again, talk to your doctor if you're confused and not sure. But in general, we've been doing vaccines for a really long time.
And I think that's such good advice. Just talk to your doctor. If you trust your doctor and you have a really good one, they're going to guide you in the right direction.
Absolutely.
All right. Well, Dr. Fish, thank you as always for coming in, and we'll see you next week to chat about more health.
Sounds good.